We have been living with this virus for over 40 years now. HIV, unfortunately, has impacted many communities.
The epidemic definitely waged war on different kinds of communities. I think what it also did was create soldiers who were staunch advocates to move either legislation forward or research, fight for dollars to provide services. There's so much available now.
In 2012, when I received my diagnosis, I immediately thought, I'm going to get AIDS and I'm going to die. I was broken for a little while and had to be connected to resources where I soon learned that that wasn't the case and that there is amazing medications that have been developed over the years to help suppress the virus and support the immune system and help those who are living with HIV live a long and healthy, normal life.
Thankfully, because of strong science, committed public health professionals, and fierce advocates, the disease has really evolved quite rapidly from something that was at once considered a very acute illness with short life expectancy, high death rates, to something today that's a chronic, manageable illness.
Currently, right now in the HIV epidemic, we're looking at a long-acting injectable medication. And with the advancements, who knows, maybe a cure will be inevitable down the road as well.
It used to seem like hope was lost in people. And hope, I believe, is restored.
We have come so far when it comes to educating people and making sure that they have access to care and services. And it's through planning bodies like this.
The Connecticut HIV Planning Consortium is a group of providers, consumers, people living with HIV, people invested in the field of HIV, working together collaboratively to stop the spread of HIV.
It's a group of people committed to ending HIV in Connecticut. Health providers, people with HIV, advocates, researchers, really anyone who's willing to kind of do their part to ending HIV in Connecticut.
This is a community, and so it's a learning space. It's a space to also honor those who have come before us and to also look towards the future.
Elevating the voices of those who are living in the state of Connecticut with HIV, helping them live as normal and healthy lives as anybody else.
Y esas voces de las personas que viven con el VIH es muy importante porque solamente ellas saben cómo y cuándo se le debe ayudar, en qué manera es más efectiva para la ayuda en su comunidad.
So I've been a part of the CHPC ever since 2012 when I received my HIV diagnosis and had an opportunity to participate and actually hear about what the leaderships throughout the state were discussing and planning on doing. And it was very encouraging and made me feel really welcomed, like I truly had a voice in what I felt I needed as far as care. I felt very empowered. It was an amazing feeling of support, and I have made some lifelong friends through attending the CHPC.
It's also great to see people who came in newly diagnosed, got on medication, they're virally suppressed, and now they're working alongside you to help bring other people in.
I can't think of a more committed and passionate group of individuals who, for the most part, are volunteering their time outside of their other commitments. Advocates and scholars and providers and people with HIV who, all fit different pieces of the puzzle to ending the HIV epidemic in Connecticut. If someone was interested in getting involved but wasn't really quite sure of the work we do, level of commitment, I would recommend two things. First is visit the CHPC website. It's a one-stop shop for everything we do, all of the agendas and meeting minutes and resources. The second thing is to reach out, come to a meeting, right? Just listen, be a fly in the walls, and then see if it interests you. If it does, we welcome you.
Just come in if you're a little scared, a little nervous, or maybe English is your second language. There's people that might speak your language. I speak Spanish, so bienvenido. You come, me pregunta, and we'll make it work, okay? So you are making a difference, you're making an impact, and I welcome anybody that wants to join.
Cualquier persona se puede comunicar con cualquier miembro de CHIPS o mi persona también. it's fácil. And so the call is for everyone to step up and step out and elevate your voices and come to the table. We welcome you to come to this table and help us fight this epidemic.
And so I hope we get to the day in my lifetime where I can say comfortably with science and with evidence that the HIV epidemic is once and for all ended. And I look forward to that day. And I know that the CHPC will be really proud that they contributed to that goal.